very curious, are we the only young people in the People's Health Movement? I think we need to do some more recruiting of young people if we really want to sustain the movement towards achievement of health for all. So again, good morning. I'm Renzo Quinto from the Philippines. Unfortunately, Prem, I'll not be talking about activism in the Philippines, and I guess many of my colleagues from the Philippines have covered that in the other sessions. But this morning, I'll be talking about the International Federation of Medical Students Associations, or IFMSA, which for the past 2 years has been doing some work on issues pertaining to global health equity and social determinants of health. Because we believe that what we're doing now will hopefully determine health in the future. Hence, the title is Medical Students as Determinants of Health. So IFMSA, in just a brief backgrounder, it's an independent, non-governmental, non-political federation of medical students from across the world. It's founded 3 years after the founding of WHO. It has 108 organizations from 101 countries. So most likely your countries are represented in the federation. And we have more than 1 million medical students worldwide. And the federation, in fact, has a close collaboration with the United Nations and the World Health Organization. So we get to attend all the important meetings of WHO and the United Nations. We have internship programs in WHO, so we don't only watch WHO, just like what the People's Health Movement has been doing, but we also work with WHO to further encourage, especially the positive side, the good job that they're doing in improving people's health. Our mission is, I just want you to focus on the last line. We want our medical students to become doctors who will influence the transnational inequalities that shape the health of our planet. So we are not just geared towards making a clinician or a doctor who has lots of titles at the end of his name. But we want doctors to really make an impact, changing the world, reducing inequalities, closing the gap. So this is one typical picture of an IFMSA conference. You'll see medical students from across the world gathering together, learning from each other, sharing best practices, and basically talking about our vision for the world. And now I want to just narrate to you what happened for the past 2 years. Interestingly, even if IFMSA has placed in its mission to address inequalities across the world, it's the first time last year that we came up with a policy statement where we declared health inequalities as unacceptable and unfair. We reaffirmed the principles of the Alva Declaration of 1978, and we placed action on social determinants of health as a key policy and advocacy focus in the Federation. This policy statement will actually usher a long series of activities and changes in the Federation, because we are really serious about closing the gap in our generation. So we had a small working group of medical students from different continents tackling issues of health inequality, coming up with position papers, and developing educational tools, because health inequality, health equity, these are subjects or topics that we don't often talk inside the medical school or in a classroom. So we're helping develop tools so that our members, our 1.2 million medical student members, will have some idea about the enormity of health inequality and the different ways on how we can address this. We had a session in last year during our 60th anniversary conference. We were graced by Professor Sir Michael Marmot, who is the chair of the Commission on Social Determinants of Health, and he was astounded by the surge of support and interest among medical students becoming part of this global movement towards health equity. We also attended regional meetings in Asia, in different continents on social determinants of health, because each region of WHO is actually developing strategies, and we were able to participate in the processes. We came up with campaigns within our federation. So if you will see root out, reach out, we want our medical students to commit to rooting out the causes of the causes of health inequalities and to reach out to the poor, to the underserved, to the marginalized, and to vulnerable communities. So it's meeting the immediate needs of the vulnerable populations and rooting out, creating long-standing changes, reforms in society in general. We have a website where we basically, through which we have updated our members about our different initiatives globally and nationally. And our country, so we didn't stop at the international level. For example, in Chile, they were quite progressive. They approached the Ministry of Health and they organized their Congress on Health and Poverty in order to engage not just the medical students, but the entire health sector. How we can address health inequalities in Chile through action on social determinants of health. We were able to publish an article in the Lancet where we expressed our stand on the issue of health equity and gave some recommendations, including incorporating the social determinants of health approach to medical education, and even in the education of other professions like lawyers, economists, engineers. We all need them because acting on social determinants will require whole of society initiatives. And we were there at the World Conference on Social Determinants of Health, and that's the first time we met the whole family of the People's Health Movement. And during those 3 days, we debated with WHO and member states. We lobbied to governments. We talked to civil society and started partnerships. So this has been a very transformative moment in our federation as it deepened further our commitment to acting on social determinants. And we know Dr. Eugenio Villar is here. He gave a very elegant presentation 2 days ago about the real political declaration on social determinants of health. And the medical students are quite unsatisfied with it, so we came up with our own alternative declaration because you will see that, and I know many people within WHO, outside of WHO, they will say that there are some areas that were not touched, and one of those is how the unfair distribution of power, resources, and wealth will be addressed. And we wrote it there in the declaration. So while the official declaration is being circulated to governments, we are also circulating our own alternative declaration. PHM also has their alternative declaration. And then recently, last March, we established our IFMSA Global Health Equity Initiative. So if you will notice, all our activities pertaining to health equity, they were just projects or campaigns or small initiatives from a specific group of individuals in the Federation. And then we officially turned it into an initiative that will sustain all efforts in the Federation pertaining to the issue of global health equity. You will see our picture with Dr. Eugenio Villar because WHO has been also supportive in our efforts within the Federation. And then we also came up with publications. This publication is a recent magazine, and we basically gathered the ideas of medical students on social determinants of health and the issue of sustainable development, which we all know is a crucial determinant of health, especially at the global level. We were there during climate change negotiations. We've been in Copenhagen, in Cancun, in Durban, the most recent, and we really lobbied for the incorporation of health in climate change, in how countries will address climate change. And then most recently, we were in Rio for the Rio Plus 20 Summit. So we know that they celebrated the 20th anniversary of the Earth Summit, where they discussed post-2015 goals and how we can improve or protect the environment, green the economy, etc. And the IFMSA was there. You will see the picture of our delegation with the Director General of WHO, Dr. Margaret Chan. So what are next steps? We're involved in this Commission on Global Governance for Health. We are here at the Third People's Health Assembly to show and express our solidarity with the entire People's Health Movement. We will be meeting this August in Mumbai to talk about universal health care and how medical students can partake in this global movement. And just to close this presentation, we really need to work harder in terms of transforming medical education across the world. How we can integrate human rights, the social determinants approach into medical education. Because again, our aim should be coming up, producing doctors who will be champions of the social determinants approach to health. Community mobilizers, health leaders, social change agents, catalysts. And we're being reminded by Thomas Alva Edison, what kind of doctors do we want to have in the future? And he was saying, he's not a physician, he's an inventor, but he has a vision for medicine. He said, the doctor of the future will give no medicine, but interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. And then another popular person in the field of social medicine, Dr. Rudolf Virgil, in the 1800s. What did he say? He said that medicine has the obligation to point out problems and to attempt their theoretical solutions. The physicians are the natural authorities of the poor. That's the kind of doctors that we want to produce in IFMSA. And since I'm from the Philippines, I also want to invoke the spirit of our national hero, who himself is a doctor, who wrote 2 novels that sparked the Philippine Revolution, or fanned the flames of the Philippine Revolution in the 1800s. He was murdered, or rather killed by the Spanish regime at the age of 35. But he showed to us that we cannot fully heal the country if we do not free the country from the manacles of colonialism. And what did he say? The youth are the hope of the fatherland. So we have to start working not tomorrow but now as medical students. And interesting, just to share with you, these 2 leaders of social medicine are good friends in the 1800s, back in the 1800s, when our hero, Dr. Rizal, went to Germany to study ophthalmology. He met Dr. Virchow, and they had very interesting discussions about how we can make this world a better place. So, just to close, you are assured, People's Health Movement, that medical students across the world are with you in this struggle for health for all. Thank you.
Well, thank you, Virgil. It's such a very inspiring and